Water fluoridation has been described by the Surgeon General of the United States as being one of the top 10 public health measures of last century.
Water fluoridation is the near perfect public health measure because it applies equally across the board to a whole community.
It's quite clear that it is totally safe, and it has been hailed as one of the 10 most important public health initiatives of the 20th century.
It's a sensible thing to do. It's just another means of prevention.
Fluoride is only one piece of what we deal with when we're trying to protect teeth. So you need to have people having good education about what's good diet, making sure that they're not drinking too many sweet drinks in particular. Soft drinks has been quite a considerable problem. And so we've changed our diet so much in the last 50 years that the difference between fluoridated and unfluoridated areas is quite marked.
Fluoridation was started and the equipment tested in April '56, and it wasn't until June '56 that we had a professional turning on by the late Billy Sheehan, who was our local member, and he was the Minister for Health. We were the first, then Cooma was next, Goulburn was next, and Canberra Queanbeyan was next. It was the whole of ACT's Southern Tableland area. The first fluoride research I ever came across was 1878, where a group of Franciscan monks were doing it, experimenting with fluoride then. Well, Dr. Graham, who was a GP in town, brought the idea to me and asked whether I was interested in fluoridation. I told him I was. He took it to council, and council then decided to fluoridate the water. It's one of those things that people say, oh, it's murderous, it's this, that and the other thing. Someone wrote me a letter saying I was causing dry birth, whatever that did. I was spreading communism via the tap.
Fluoride's essentially an element, and it comes essentially from fluorspar, which is a crystalline rock form, which presumably prior to that came from the ocean when this was go back a couple of billion years, and this area here was the limestone bed of an ocean. Australia has the greatest penetration of fluoridation of public water supplies out of most of the North America, Europe, etc. We know it's safe because, first of all, we have watched for adverse reactions now for over 50 years, and in the United States a fraction longer. Prior to that, of course, dental infections were lethal. In quite a number of cases, the loss of life was very substantial. So we know we're doing a lot of good. I can't think of a single health risk that's been sustained. It's free from any undesirable effect in pregnancy. We've looked very carefully for now 50 years, and we're just not finding anything. What we're finding is just the opposite, that life expectancy is increasing, that the loss of life from and inconvenience and threat from gross infections has decreased.
Many children have got such severe decay in non-fluoridated areas that they need to have their teeth fixed in hospital. And typically this would mean that under a general anaesthetic they would need to have several teeth extracted and then a whole swag of fillings done. So this is very expensive, and of course there are associated risks of having general anaesthetics. There's the evidence of the dramatic reduction in tooth decay and in the number of people who have lost all of their teeth, which has dramatically declined since water fluoridation and the use of fluoridated toothpaste. We were investigating the introduction of water fluoridation into the Blue Mountains, which occurred in 1993. And we looked at the children again in 2003 after fluoridation had been there for 10 years and measured the impact that it had. Now the impact is measured in two ways. Firstly, the proportion of children who have no decay increased from 60% to nearly 90%. And secondly, the average number of decayed teeth decreased by 70%, both in the primary teeth, the baby teeth, and in the permanent teeth. What we would see is that people would have far fewer fillings, especially in their front teeth, so that people's teeth would look more attractive, they wouldn't have stained fillings and that sort of thing.
The typical concentration is 1 part per 1,000,000 parts of water. And I think if you use this as a rough analogy, it's like a couple of grains of sand within a bathtub. And sometimes people ask me, is it possible that you could drink enough water that you could reach a toxic level? The short answer is no, because to reach a World Health Organization